Welcome to another insightful episode of Me and My Health Up. The purpose of this podcast is to enhance and enlighten the well-being of others. I'm your host, Anthony Harcher. I'm a clinical nutritionist and lifestyle medicine specialist. This episode is on Eastern Health Prospective, with a specific focus on traditional Chinese medicine, often referred to as TCM in abbreviated form. Today we have with us Master Aaron Khor, who is a TCM practitioner and has joined us. So welcome, Aaron. How are you?
Good. How are you, Anthony? Thanks for having me.
You're welcome. I'm fantastic. So a little bit more about Aaron. So from the age of 5, Aaron has been practicing the martial arts form of Tai Chi. He was first introduced to the combat and self-defense techniques by his father, Grandmaster Gary Khor, the founder of the Australian Academy of Tai Chi and Qigong, Chinese martial arts. Master Aaron Khor combines both Tai Chi and Chinese medicine together in helping his patients and his students with their healing processes and maintenance of their general health. He completed his training in traditional Chinese medicine in China with Qidong University Hospital. Correct me if I'm pronounced that wrong, Aaron.
Cheng University.
Okay. And that's where he completed his traditional Chinese medicine, and he then completed his degree at the University of Technology, Sydney. In addition, he's completed a health science degree at the University of Western Sydney. So certainly well qualified and loads of experience from early childhood days. So such a delight to have you on, Aaron. So thanks.
Thanks, Anthony.
I'm really interested in sharing with the listeners and viewers this whole philosophy around traditional Chinese medicine. It's very different to our Western medicine approach, and I'm really keen for you to give us a synopsis view of what it is and how it differs from Western medicine.
Okay, so let's take Western medicine first. In Western medicine, a lot of the times they look at the body in specific parts, and they're wanting to look at what specifically inside the body is causing that type of problem. So a lot of the times they do a little breakdown of each part of the body slowly, and then they focus entirely into that spot. And in Chinese medicine, it looks at the whole entire body as one. Whereas if there's a pain in a particular area, it will still affect their entire body based on their constitution, based on how they're feeling emotionally, and how their health is generally overall as well.
And so it's really very much holistically seeing the person as a whole, and really then taking the approach to improving their health and well-being from that whole perspective.
Yes, that's right. So
Okay.
you always want to find a good balance in Chinese medicine, whereas sometimes in the Western medicine side, they only take into account what's causing the problem, and they only treat that particular area without considering the other aspects that may occur later on.
Okay, so let's take mental health, for example, because we know that's been really affected detrimentally in this COVID period that we've been going through. So really keen to, let's say, take mental health, for example. Modern medicine would very much focus on the head, the thinking, the cognitive processing, the behaviors as a result of that cognitive processing, and really hone in on the head, so to speak.
Mm-hmm.
Now, from your perspective, from a Chinese medicine perspective, if this client came to you and said, look, I'm feeling down, I've been let go from my job, I'm feeling, just feeling very anxious, and just, there's so much uncertainty around whether I get another job and where my income will come, whether I can meet paying the bills. And as a result of that, I'm not sleeping at night, my energy's low. So if that person came and presented to you, what would be the process that, I guess, hypothetically, how would you think through the situation? What would you, what examinations would you do? How would you get to that sort of more Chinese diagnosis as to what's going on, what's the underlying problem? And then from that, what would be your course of treatment?
Okay. So if a patient presented with these kind of problems, the first thing we do in Chinese medicine as a practitioner is that we actually use the four main methods of diagnosis through asking, listening, hearing, and also feeling with, as well as taste, except that's one that the patient would actually tell us what they would be feeling around the taste area, which would indicate something different. In doing this, we would ask the how they feel and how they have developed into this condition. And through that process, what we're looking at in Chinese medicine is how the body's changing from the state that it's in terms of the elements, just like nature outside in the world. So right now it's hot summer. Sometimes we have the heat just come out all of a sudden, and then we have the change straight into the windy and then turning into the rain. So then let's use a simple logic to help understand that. Let's use water and fire in the body. So a lot of the times we want the water and fire to sort of be balanced a lot, but it's never always equal. It's always one up, one down, and constantly trying to maintain that. In the person feeling very down and anxious after losing that, very detrimental, emotionally, what we look at is how that affects the body's mechanism and the way the flow of the blood changes. So when blood moves, Qi is moving. And now in a simple term, let's call Qi in Western medicine energy. That's what they bring it down to. So when the blood moves in Chinese medicine, the Qi is moving as well. But when there's an emotional change to the body, the different emotions cause the body to react differently, and that is what causes obstruction. So for example, let's take fear as one. If someone's always fear and frightened, and then they always curl up, hold in, that contracts a lot of the body without unnecessary energy uptake. So when it takes that energy, it consumes it and causes the person to slowly diminish down. So now we imagine the water and the fire. What happens is, instead of the fire bringing the life up, the fire is going down from the consumption of the energy, and the Qi of the water starts to increase a little bit more, or it might stay level where there's no change. Then that relates to temperature change in the human body, and that will also determine whether they feel cold and whether they feel like doing anything at all. Whereas if we take weather and nature, for example, when it was raining the other day, what do most people do? They stay in and they order Uber Eats through the phone. Whereas when it's really sunny, everyone goes out, enjoys the weather at the beach, because all the heat and the yang energy, which is the active part of the body, moving the blood, makes us very energetic. So that's why we move out, and then when it's too cold, we move inwards. So in part of this, that's what we're looking at in looking at the patient when they come to us in this situation. Now, when we go towards the process of actually treating this patient, the first thing we want to look at is calming the patient down first, so that the body sort of settles down in a natural, almost level state, just for that moment, just for a little bit. And that contributes into breathing, into the mindset, because the mindset in Chinese medicine, we relate it to the heart. So if the mind's thinking a lot, then the heart is really disturbed, and that would actually disrupt the flow of the Qi in the body. So one part of the body that's disrupted will disrupt the others in sequence overall. So in getting the patient to even lie down and just lie there for a little while, closing the eyes, then we perform some acupuncture to help direct the qi towards the right area or strengthen it by either tonifying and building it up when the patient is actually relaxed, just like when we're sleeping to rebuild.
I really like that approach. The fact that you're going through this whole process of, assessing the individual at the very beginning, and that's, the basics around asking, listening, and getting a sense of how they're feeling inside. So what's going on, when you ask about their feelings, they could say, I'm feeling sad, I'm feeling down, I'm upset all the time, or I'm angry or something like that. And so that also plays into your assessment of, where I need to work and support that individual. So I really like that, that initial approach. And then the fact that and I can see lots of parallels in a sense with Western medicine, although they're sort of going very much down to that, really reducing the issue into a particular area. In a way, you are, in some way doing that, but then also looking at how that affects the whole, right? Because, we spoke about the mental health and you mentioned, okay, so if the mind's turning over a lot, that affects the heart directly. And that the heart obviously affects the flow of blood, which you said correlates to energy or the qi moving around the body. So then you're looking to calm the mind, and that obviously has a flow-on effect to the heart. And then, as a result of that, you will get more better dispersion of qi and energy throughout the body. Have I understood you correctly?
Yes, and that's part of it. The only other aspect is when we go in a bit more detail. So if we're going back to talking about how the mind is related to the heart, it's actually in Chinese medicine, they look at the spirit that's connected to the actual organ. So a lot of the times when the qi is moving in the body, and if there's too much sort of, let's say in a hypothetical situation, the person's very hot, and they feel hot all the time, a bit of red face, red eyes, then everything's floating upwards towards the head. So when that goes upwards, it actually disturbs the heart. So if we think of an analogy of disturbing the heart, just imagine trying to walk in a cloud of mist or haze or fog. You automatically lose a sense of direction, the breathing changes. And when that comes out, it disturbs the mind constantly. So it's making the mind constantly moving, as opposed to settling down. So when that heart organ tries to push the blood around, but also move the qi around, it actually has difficulty trying to disperse the qi around openly and freely. So let's say, for example, in another simple sense, if we use a Western medicine type of idea, it's circulating blood, comes from the heart pumping with circulation around. So if the blood doesn't circulate properly, then the other organs actually can't receive the right nutrients and minerals. So in Chinese medicine, that's the disruption in the flow of qi. When it tries to tonify and strengthen and rebuild those organs, it can't reach it. And therefore, the movement becomes trapped, and therefore it doesn't move. And that's what we relate to as stagnation. So in other sense, when we talk about qi has the direction of moving inwards, outwards, up, down, out to the sides. It moves in all different directions. When something is disturbed in the body, or an organ function is sort of failing or starting to deteriorate, the movement of that particular organ's flow of qi actually causes the disruption and changes the way the other ones move. So that's another sense of getting into it. So it gets a bit very detailed. So that's the general basis idea behind something causing like that in that sense. So in mental health, if that person was very anxious, very unsettled and unable to do anything or think clearly, getting them to lie down while giving acupuncture we would use somewhere down away from the body, so down away from the head, more like the feet. We use the points of the feet to draw all that energy away from the head down, but then circulate it properly to the right area, like giving the body a command. So that's the way we would actually do it and approach it. But every practitioner has a different way of doing it.
Sure. Yeah, it's the same as in Western medicine or complementary medicine. You could have the same training, however, your approach is slightly different. And yeah, I totally understand that. Yeah, so it applies a lot of, the way in which the what you're describing as to what's going on. And if I'm thinking from my perspective is, when someone's anxious and their mind's very active, then it implicates their digestive system. And you mentioned that the chi is elevated up if that person is hot and hot inside. So all the energy is upwards. So that means the energy is not heading downwards, and hence, therefore, the function, below the, say, heart line or below the spleen is somewhat, less, and hence, then you'd expect digestive issues such as potentially constipation. And I often see that in practice, where someone is constantly in that anxious state. They may be, experiencing that constipation. And I'm thinking, well, it makes sense in terms of what you're saying, because their energy is up in their head. There's not much going downwards.
Mm-hmm.
And, in terms of your approach with the acupuncture and drawing the energy down by putting the pins or needles or whatever you call it into the ankle area, that would help, move the bowels and relieve that constipation.
Yes, that's right. That's what we would be looking at and doing, because if in a sense like that, of what you see in your practice, if the patient had those symptoms right after they got the sort of the high anxious level, and then they start to feel constipation, then to us in Chinese medicine, in a way of our process and thinking, one of the things we would be asking then is the water intake, and then what type of food they're actually eating, and what's leading up to the dryness. Is there dryness around the actual anus region? Is there any sort of what we call any aches in the lower abdomen region? Is it difficult to pass out? And are you eating a lot of hot foods or sugary foods that are dehydrating the body as well? Those are the things we would be actually going for to look at, similar to how you were thinking about how it affects the digestive system at the same time as well. So yes, that's the sense that we would also follow, similar.
And just on from that, I know, and you just mentioned it in terms of when you're looking at food and looking at the person's intake and, correlating that with the symptoms or the signs they're experiencing, you very much take into consideration the energetic properties of the food. So, and there's other properties you take into consideration as well. I think there's the that sweet, the sour, the bitterness. I'm missing one or two, and a wet dry, and so and as you mentioned, whether the food's heating or cooling. So just like, from my perspective, if we get to the constipation, okay, so now we've starting to, we want to move the energy down. We want to help the person move their bowels, help them relieve their digestive concerns due to the mental health that we said of this hypothetical client.
Yeah.
So certainly, from my nutrition point of view, I'd be asking about water intake like you. And would also be talking about foods, but probably more, are they having enough fiber? So we know that fiber helps move the bowels. Water, again, it's that lubrication. It's that, and I think probably correlate in some ways. There's some close connection with the way Chinese think about it in terms of too much wetness or too dry, or so I'm really keen to explore this energetic properties of food, or your way of looking at the diet for this person that's now, experiencing digestive issues from a mental health perspective. So take us through that.
Okay, so when we're looking in terms of the food properties, when we actually look at the food itself, we also got to look at its color and its taste. And what we also notice, which most people in the general population probably don't think about, is the way it moves the actual flavor in the body. So in another sense, in Chinese medicine, how it moves the qi inside. So let's take chili, for example. It's hot, it's red in color, indicates the fire element inside. And when you take it in, it disperses a lot of the flavor going outwards. Plus, you would also notice when it's hot, it feels very drying in that type of nature. So in the person having digestive issues and constipation, the main thing would be is what discomforts are they feeling when they ingest certain particular types of food. If it's constipation occurring and there's not much problems with, as soon as they eat the food, they feel that, they feel like they're going to throw up or something. If there's no symptoms leading to that, then in this case, we'll be looking at lubricating that intestines more. So eating something like nashi pears, or even cooking nashi pears, boiling them with some red dates and goji berries with a little bit of rock sugar to help hydrate the body, is one way we look at helping them to naturally rebalance the body without taking any of the herbal medicine yet at the early stage, unless they really wanted it. So that's what we always look at in terms of food. So another one would be, even if it's very hot, we would use apples. Apples is also a cooling effect, but also has a little bit of fluid inside. And that actually helps to really cool down the heat, especially when it's dry, you create the moisture. So the best thing to do is to eat foods that have more fluid and watery. So watermelon is one that is good to help when there's a lot of heat and dryness inside, to help cool it down and move the fluids around more freely. That will enhance the blood flow as well as being able to digest and extract the essence from the food to feed all the other organs. So in Western medicine, think of it as nutrients and minerals being able to spread out through the bloodstream into the cells and being able to replenish and repair the internal organs. So once that is being changed through that process, we would then look at giving other types of foods, such as eating the vegetables a bit more, to help ease the digestion. Okay, if the digestive part of the stomach was very uncomfortable and they kept getting watery diarrhea or something, for example, or not just being able to pass anything out through constipation, then even something like congee in the Chinese culture, where they eat the congee with the rice, and because of the water and the fluid and the rice is so soft, the digestive system has an easier way of breaking that down and absorbing that too. And that can actually then sort of go down and spread into the intestines to lubricate. The importance in Chinese medicine about the foods is not to eat the wrong ones and to create a balance. So if the person has constipation already, avoid any hot, dry, fried foods, any oily foods, anything that causes the body temperature to go up instead of cool down, because that will only dry up the fluids further. And if the water intake is already very low, then the person will get symptoms of such as something like dry lips, dry mouth, feeling hotter than the person next to them on a normal day when they're not even feeling hot. So these things will occur, and even pain upon defecation and straining can occur. So multiple different types of symptoms can occur and signs through eating the wrong foods, but eating correctly is the main thing to balance the body out. So we go back to water and fire. If the constipation and there's dryness inside already, water's gone down, fire starts to rise a little bit. There's the imbalance, so we want to bring that down back together. And we're just using the water and fire element as just a general and simple way to help listeners understand what we're talking about.
Okay, and just we all spoke focusing then on constipation, and we spoke a lot about the dry foods and foods that raise the heat. We don't want that. We want to move the bowels. We want to get that out of the person's digestive system. So we're looking to lubricate the gastrointestinal tract, and also keeping the energy down there. Now, in the case of, because with extremely anxious people, if you're having a bout of anxiety, it can result in those, the diarrhea that you mentioned. You touched on diarrhea, and obviously that's where it's moving too fast, and there's not enough absorption of the nutrients from the food, and you're not getting the nourishment from the food. It's just passing through too quickly, and also the person's losing hydration status and minerals. And so from that, would you then so you mentioned like the hot foods such as chili is drying, and it raises the heat, pushes the fire up. So you would then, for diarrhea, apply that. Have I got that right?
So wouldn't apply the chili. Would more say, so do not eat any of those type of foods with those type of properties. So avoid the chili. In this case, for me personally, I would tell that patient to actually have some congee to start off with, because of the easy digestion, easy to absorption, and more because it's got more fluids. Even if they do pass out some of the diarrhea very quickly, at least they're still getting some of that simple breakdown first. Otherwise, if they eat something very heavy, yet they're not feeling well, the state of the person's constitution is already affected. Therefore, it will, if it's already started down in the lower part of the abdomen, the intestines, and it's already dry, then eating a large amount inside and blocking the stomach itself would make it hard to actually digest. And essentially, they could become even more exhausted from trying to digest such a heavy type of food. So the watery type of food, the congee would be one of the most simplest and basic ones I would push.
So the congee for diarrhea, is that what?
Congee for diarrhea as a start to help with the digestive system at the same time as well. But if it's constipation, dryness, then the congee as well. Because it depends which part you're looking at the same time. In Western medicine, I do hear some people say they eat bread for the diarrhea as well, or sometimes even toast. So, these are some general things that people say. But in terms of when you notice something not being digested easily, even if you're eating other type of foods, then it's always good to go back to the most simplest one. And that's what Chinese medicine also looks at, is that, don't put pressure and strain on the energy systems in the body, but use the simple foods to help create the digestion process to slowly build up again.
And so you wouldn't, where I was coming from was applying so with diarrhea, it's lots of lubrication, very moist, and, it's fluids, a lot of fluid movement through the intestines.
Mm-hmm.
So I can understand why you'd want to replace the fluids, like you said, with congee. But would you want to apply an element of somehow drying it up or slowing it down? How would you, I guess that's my question. How would you either just slow down that motility to put a plug, so to speak, on the diarrhea, Yeah, or is that through increasing dryness of dry foods? And maybe that's where that wife, the old wives' tale is around eating bland bread, dry bread. Maybe they see that as putting in dried. Yeah. So that's my question, just around the diarrhea and the trying to slow that rapid motility.
In that case, then the first step would actually not necessarily eat the food to dry it up, but more to strengthen the internal parts, particularly the stomach and the intestines, from causing that diarrhea. And then when you look at it in Chinese medicine, you also got to look at the function of what's causing that diarrhea. So for example, if someone has a deficient, weak spleen in helping the stomach digest as their yin and yang partners, sometimes when the fluid and the water moves into the stomach with the foods, instead of being pushed around, it will sink down into the intestines, causing the diarrhea. Other cases is an excess of what we call dampness. In another sense, in Western medicine, you can refer to as water retention in the human body, which turns into like body fat at the same time. And that's actually blocking a lot of that. So what you want to do is you want to eat the vegetables more to help slowly strengthen the center of the body easier. Don't necessarily have to eat meat, but eat the smaller portions of the meat as well to help strengthen that part in there. In some cases, if the patient was, let's say, he was very damp inside, but then he was having diarrhea, we may use something like ginger as part of drying it up internally as well. But that's also balanced with the other foods it's cooked with, mainly as well.
Okay, yeah. So it really depends on, as you said, the driving causation behind that diarrhea,
Yes.
and you need that information in order to best prescribe the right foods to balance the condition.
That's right.
So in that response, you mentioned yin and yang. It'd be good if you could just explain in simple terms to listeners, viewers, what yin and yang is and how it works from a Chinese medicine perspective.
So when we talk about yin and yang, we also talk about the dynamic interaction of what everything is around us, constantly changing, constantly moving. In terms of, let's make it very, very simple. When it's the yang energy, there is movement. There is, there's sunlight, that's day. And then when it's cold, yin, everything begins to settle, then nighttime comes and then there's the moon as well. So it's always a constant of change between different aspects. So you can say heavy and light, or dark and light, shade and no shade at the same time, contraction versus no contraction at the same time. So the yin and yang is always something that's constantly changing. The energies around you that you always see. So if you take your body, for example, there's always some form of hardness and softness on the inside. And when we're looking at that, we're trying to find the best way to actually relax and balance that inside everything. So if we take the yin and yang symbol as a general overlook, it represents balance, but it doesn't just represent that itself. It represents that even in the softest part or the most hardest part, there's always soft and hard within each other. Otherwise, if everything was a complete state in one sense, then you will probably not have any balance or no life in that sense. So yin and yang is always a dynamic interaction of changes occurring around us at the same time.
Okay, Very insightful. And yeah, I love that whole philosophy around that real balance and that it's a dynamic state. So it's, a constant conversation I have with my clients is that you don't just arrive there. You need to be constantly working at achieving that balance, and it's a constant, it's dynamic, so it's not just a point that one day you arrive at this perfectly balanced life. It doesn't happen that way. You need to be constantly working towards that balance, and that's very much that yin and yang concept. So it's a very dynamic state. It's about balance, and there's always two opposites, whether it be hard, soft, night, day, contraction, expansion. It's the balance between these two things. And I was thinking, just in terms of your response, when we go back to this anxious person, this stressed person, muscles are often found as tight or hard. Maybe it's, I don't know the terminology you use, but, there's obviously, around the neck area is tense. And that probably the chi's up, as you said before, the energy's up in the person. So they get tense muscles and things like that. And with, you've mentioned the acupuncture, but also Chinese medicine there's a massage to it. There's also cupping techniques. There's so many ways in which you can help this person relieve this muscle tension. So maybe you just go through some of the thinking behind, really tense traps. Maybe the person may be experiencing some headaches, some sort of, some of the techniques that you may apply in combination, whether it be food. Also, I mentioned the cupping, the acupuncture, the maybe some breathing exercises. So yeah, just take me through some of the approaches that you would take to someone feeling really tight in that neck area, potentially getting some headaches.
Mm-hmm. Okay, so if someone came in like that, the first question that I would always check with is, have you ever had acupuncture before? Because there is a difference between the Western culture and the Eastern culture at the same time when people receive treatments as well. For example, in China, a lot of the times, a lot of people, the Chinese, they actually do the treatment even if it's painful a lot of the times. Whereas sometimes in the Western culture, the pain is a bit, they don't like to deal with the pain so much, so they like to they go the opposite way at the same time. So that's very important. If someone coming with completely tight trapezius muscles and they've never had acupuncture, then I would ask them if they ever had cupping. I would start off with a much softer approach. So we also have twin massage, which is essentially translating into moving the disease out of the body. That's what the actual technique of the twin massage is to push and move that out of the body. So starting with a bit of massage to warm that particular area is to stimulate the blood flow to the area. And it also gives a chance for the practitioner itself to feel where the stagnation of the qi in the body is, along with the blood, because obviously the work environment that they do impacts on them themselves. Once the blood's stimulated and it's moving more and the patient feels more relaxed, then applying cupping first will probably be an easier approach, as that you can reduce the suction, but also the heat. So when you use fire cupping, you use the technique of putting a flame in the cup and then putting it onto the body by burning up all the oxygen. The suction then has heat, and that opens the pores of the skin to allow the suction to pull out the disease of the bad qi and actually stimulate the muscle to relax through the heat going in, and then the muscles just open up to relax. That would be a good, simpler way to approach in some of the patients I have found in doing that before putting in the acupuncture needle at that particular point, because at some stages, some people may find it very painful itself in doing that, particularly if they've done a computer job a long time and they've always got air conditioning and the air blowing at them. That's going to cause the muscle and the blood to start to freeze up. And now, generally, a lot of people don't pay attention to some of these type of temperatures and things occurring, that air is considered as wind. And when there's the wind, it will actually move and attack the body because it's the spearhead of 100 diseases. And that's what they say in Chinese medicine. So when that occurs, freezes up for a long period of time, the person can then be so tight that even the smallest touch or pinch on the muscle to feel can cause them pain. So after doing a bit of the massage, the 20-hour massage, to move the area, stimulate the blood flow, adding the cupping on top to help further relax that part of the muscle before inserting the needle to actually stimulate the muscle to the point and disperse the actual qi itself at the point. That would be the approach I would take so that they don't feel too much pain when they actually experience the treatment.
I really like how you take that very individualized approach and, ask the person as to, how, I guess it's probably not the right words, but their pain threshold and sort of, really tailoring your treatment to what they want. It's very much, I love that individuality of what you do and what Chinese medicine can do for the person. And there's so much more we can talk about because we haven't even touched on Tai Chi and Qigong and it's just such a huge subject and in itself. And I think it's definitely another episode down the track is to further explore the likes of Tai Chi and Qigong and how that can help a person's overall health and well-being. Because I think it's just such it's another conversation in itself.
Well, in relation to this patient with the trapezius muscles, and in the way that I do my practice is after the treatment, let's say they do 2 to 3 treatments as well. In between, I would actually advise them to do Tai Chi. Because in Tai Chi, you're not doing a specific exercise where you're actually struggling or tensing that particular shoulder and trapezius muscles. You're actually learning to put the joints at a lower height to actually let that muscle relax. And that's what increases the blood circulation to that area. And that gives the nervous system reaction to the brain to say, hang on, if I'm doing this, and lifting my arm and my shoulder, but I drop my elbow and help relax the joint, then that's when the relaxation comes in to enhance the blood flow. So by doing that and keeping the body, using the body to exercise with the feet is what's moving that whole circulation around, rather than just moving the arms. Because now in our daily life, we always use the arms too much and we feel that that is exercise, but we realize we have lost control of certain parts of our body. So in combination to both Chinese medicine and Tai Chi, that is how I actually combine the two together. So that it helps maintain the lifestyle as a whole of the human body instead of just treating one part as well as just feeling pain. So in another sense, treating the trapezius muscles, if they have tight, they've got headache, tight neck, then postural alignment is one big issue nowadays. And that is something why I refer people to do Tai Chi a lot.
So Tai Chi helps with the postural alignment. It helps with the movement of qi throughout the body. Anything else? There's also that connection of breath and movement. So, I'm sure that's a big part of the exercise process is breathing. So you maybe want to touch on that a little bit more in terms of how Tai Chi, because that's really going to help the anxious person, right? When they're doing exercise, plus they're breathing properly. Just provide a bit more elaboration around the Tai Chi and how it could help this anxious person.
So with Tai Chi, breathing, blood circulation, relaxation, self-awareness and confidence with spinal alignment and movement of qi in the body. So when we do all these aspects, most people would find it hard to do it as one combined together. So therefore you learn each part a little bit separate. So first learning the form on the external part, and then practicing the breathing. For this anxious person, the breathing technique of focusing just on a specific part and function of the body is what will help them actually settle the qi and the imbalances down back to its natural state. So while they're doing the breathing method, they're feeling the movement from the abdomen and the diaphragm expanding. You're also exercising the lungs. And the lungs in Chinese medicine descend and disperse the qi around the body. So when it does that, it still moves everything around, as well as moving the blood flow and the water metabolism as well. So that actually helps to settle everything in the region. And then now you think about where the heart is, it's also sitting in the same upper part of the body where the chest is. So when you do the Tai Chi, you do the movements to relax your blood flow. Positioning is what helps the person not feel like they're holding, and then so they become a little bit more yin, and then they still have yang as they're still got the flesh and the muscles holding in place for that relaxation there as well. And once that breathing technique comes in, the mind and the blood flow starts to reduce down. The blood flow goes down their legs and all the way back up at the same time. And the center of the qi begins to focus on where you're working and exercising. And then they start to feel the warmth spreading, because when the warmth spreads through the breathing method, that's also the qi and blood in the area as well.
That's fantastic. I just love how you can support a client in so many ways for one concern. You know, they come to you for mental health. You know, you're helping them with their diet, what they should be eating, drinking. You know, you're furthermore getting the energy circulating throughout their body. You know, you can help them outside of the consult with exercises to support their anxiousness around Tai Chi. You can help their muscle tension, as you said, through a bit of me&my. Is that how I pronounce it?
Yep. Yep.
Yeah, the massage, and then you got the cupping technique that's you know, further provides relief for that trapezius area, and you even got Tai Chi exercises to help with that, you know, upper tightness, and yeah, so I just really like you got so many tools, you know, to help a person.
Right.
You know, when I compare it to Western medicine, it's very much drugs and surgery. Whereas, yeah, you've got so much more to help an individual with one. You know, we only discussed one concern today, that being, you know, mental health, extremely anxious person. But you can apply, you know, this whole philosophy of what we discussed to any illness, right?
Mm-hmm. And yeah, there are many different approaches into it. And, you know, there's also the technique of ear acupuncture, scalp acupuncture for different conditions. Scalp acupuncture is very effective and popular for people with neurological disorders, loss of function of movement. Ear acupuncture is effective in different ways of the whole entire body, because if you look at the ear, it's like an upside down baby fetus placed in there. So you can see how the back, the legs, the head, the organs correlate to actually our human body. There's actually one other method that wasn't mentioned, and that is moxibustion. Moxibustion is one of the very most popular methods used in China. And originally, when you look at the word Zhenjiu, which is acupuncture in Chinese medicine, it includes the word acupuncture, moxibustion, where they use heat therapy from that moxibustion, and that's made from the plant artemisium, if I say it correctly, artemisium, and that stimulates the heat in the body to relax and move the blood to the area to actually help relax. So a lot of the times in Chinese medicine and even in Tai Chi, we can treat one disease with many different ways, and we can treat the same disease with the same method at the same time, with the same diagnosis. So There's a lot of different ways of really helping the body. And the other thing that, one thing that in the Chinese culture that they expect, also put out a lot is, do not cut into the human body unless you really need to. Otherwise, that can disrupt the flow even further, unless perhaps the person may have some sort of disorder to the point where it's too much to handle, that they actually do the surgery and cut into the body.
So it's more that last resort, but you've got so many things that you can aid the person's self-healing to apply and to support the person to heal themselves in hope that they won't need the surgery down the track. But, you know, in some cases, as you sort of alluded to, it's a necessity, but it's really that last resort.
That's right, because any disease that we develop nowadays, think about how long it's taken you from a young age to the current age you are at now. Then to reverse that process, you still need at least quite a long period of time before it starts to change. So it's very hard to get a quick fix in doing that. But there are methods where you can use the Chinese medicine modalities to help maintain for a while, and then the rest is your lifestyle, is how you maintain that longevity in your life and how you nurture your body to stay alive. So that's why I always recommend people do some acupuncture and then they try Tai Chi after, and I say feel the difference between the relaxation in the body and the flow of qi, of blood inside, and the mind. Feel how that changes the entire feeling sensation. Because once you feel something penetrate into the body, like the needle, you feel the stimulation, the nervous system starts to go, oh, I actually have this part connected to my body, yet I didn't know for such a long period of time because it's been too tight for too long, I've forgotten about it. So therefore, that's how you can use these type of methods to help strengthen your body, maintain it, and change it, and actually make something change in the body, as opposed to just going straight for the pill, or straight for the surgery or something. You can actually change this through a different method using Chinese medicine.
It's fantastic, and I really appreciate you sharing all this knowledge with the listeners and viewers, to really empowering them on another alternative to the tradition, or to Western tradition of just going to the GP, getting a drug, and in some cases over time may require surgery. But you provide a lot of help for the client to heal themselves, and then as a last resort, only in the cases of really severe, catastrophic, or acute situation, that you really need these this last end resort of surgery. And so for me, I'm thinking, well, the viewers and listeners are probably excited about the prospect of finding out about a new approach to health. It could be a new approach for some. Some may already be applying traditional Chinese medicine in their quest for longevity and good health. But for those that haven't experienced it and would like to, how can they best get in contact with you?
You can best get in contact with me through my Tai Chi website, which is khorlivingchi.com.au. Khor spelled as Khor, and living, and then CHI for Chi. Otherwise, finding me on Instagram, just with my name, Aaron Khor, you'll be able to find me. Or if you search up Australian Academy of Tai Chi and Qigong, you'll be able to still find me around there. And that will link to Facebook, YouTube, Instagram. Those will be the easiest ways to find me, because the contact details will also be listed as well.
And I'll certainly include your website in the show notes, and your link to your Facebook and Instagram, so that viewers they can go straight to the links and find you that way. So just like to really thank you, Aaron, for sharing everything you've shared with us today, and empowering us and giving us another option to support our health. And from my point of view, I've been using traditional Chinese medicine as part of, my journey for longevity, or just,
Yes.
to prevent illness essentially, and be proactive. And, I'm regularly, getting some acupuncture or some support in that sense. So I really appreciate you spending this time. And for the listeners, if you like the episode, please like and share it. Share it with others that could benefit in just having another option, I think is the key here. And stay tuned for more insightful episodes of Me and My Health Up. Thank you.
Thank you, Anthony.